Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Hello, my name is Dr. Derek Barron, and welcome to another amazing episode of the Prime Health Podcast. We interview doctors, nurses, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. We explore breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. Now, before we get into today's episode and our awesome guest, just a quick note from our sponsor, Growth Solutions. We are your growth partner for busy health and wellness professionals. Growth Solutions really does their best to eliminate your biggest headaches, whether that's finding new patients for you, new contacts in your community, improving patient communication, practice operations, systems, frameworks, and yes, even implementing AI agents in your practice to allow you to get away from practice and enjoy life a little bit more. So Growth Solutions, we're not a vendor, we are a partner in the growth of your business. So if you've ever said this, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we can help. So if you want to learn more, just drop the word growth in below, or feel free to reach out to me to any of the social connections you see with me below. But let's dive into the episode today with our awesome guest. I am pleased to introduce to you Dr. Benjamin Sibley. He is a board-certified podiatrist in Australia, focusing on regenerative medicine and orthobiologics of the lower limb. Dr. Sibley has a special focus on using PRP and laser therapies in the treatment of plantar fasciitis. Dr. Sibley uses specialized treatment protocols called the RegenCode and as RegenCode TM, as a foundation of successfully treating chronic plantar fasciitis. Sounds interesting. He's the author of Pain-Free Plantar Fasciitis Recovery for High-Performing Men and Women over 50 who want to move and feel younger than they are. And he is about to embark on PhD studies focusing on PRP, laser therapy, and the accelerated healing of plantar fasciitis. Dr. Sibley, welcome to the Prime Health Podcast.
Thank you, Derek. Great to be here.
Absolutely, my friend. Well, I always ask this question to start off with because it's a good question for people to learn about you. Was there a moment in time, was there a reason, an issue that said, you know what, I'm going to go into medicine?
Yeah, there was actually. I have really a great backstory in regards to this. I played a lot of sport when I was young and at school, and by the age of about 15, my body was breaking down, so I had really bad chronic shin splints, had chronic lower back pain, chronic shoulder problems from playing sport in Australia called cricket. And I saw many doctors. My mum took me around to many doctors, and basically the end of the story was give away your sport, take time off from the sport. So an active 15-year-old, you don't tell them that they have to give away their sport. So we went to a sports medicine physician. He diagnosed a lot of the problems were coming from my feet. We went and saw a podiatrist. The podiatrist analyzed my gait, made some adjustments in my running style. We got some custom orthotics, and then 3 months later, I was pain-free and haven't had problems since. So it's, and that really, really impacted. Yeah, I really enjoyed that process. I enjoyed the process going to the sports guy, the rehab process, and the podiatry side of it. And I thought, okay, well, I'm going to go and do podiatry. So went and did podiatry and studied podiatry. And 31 years later, here I am. So it's So the other good thing is I still play a lot of sport, even in my 50s, and you get the odd injury here and there. So I understand pain, people's pain, and wanting to get back into activities after, suffering from injuries and things.
Yeah. Well, that's very interesting because you literally went into what you saw, meaning you saw a podiatrist, you went into podiatry. That's fantastic. A lot of people said, I'm just going to try something in medicine. So I like that you had, the experience with the podiatrist and dove into it. That's good. We'll talk about more of it, but it seems like plantar fasciitis is the key for you. Is there what's your underlying reason of why you're going so strongly after the diagnosis of plantar fasciitis to help patients?
Well, probably makes up a good proportion of my practice and most podiatry practices. And it's as time has gone on, it's what I have found with plantar fasciitis. It's not all plantar fasciitis is the same. So, a doctor gives you, okay, you've got a diagnosis of plantar fasciitis, but there's so many nuances in regards to this specific condition. So, and the nuances are how it presents, the symptoms that are involved, how it responds to treatment, and the actual tissues that are involved in this particular condition. And early days of my training, I go back to how we were taught at university how to treat plantar fasciitis, and how I treat it today is like polar opposites. It's 180 degree separation in terms of how I look at managing and treating plantar fasciitis these days. And with the study that I'm doing, what I'm finding is that as I'm doing more, I've never been a researcher, but this has been really, really great as I'm delving into the research and the studies, is that there's such a great divide in terms of agreements, protocols, how to diagnose it properly, and then build a really good, efficient treatment system around those diagnoses. And so it's the more I'm sort of exploring it, it's not sort of the more answers I'm getting, it's often more questions that we're getting to answer in regards to this specific condition. And the other thing is, medicine tends to be fairly singular type. Okay, you've got joint arthritis. Let's give you some medication to try and get rid of that pain, or let's give you a steroid injection to try and get rid of the pain, or let's give you some exercise to get rid of the pain. And more often than not, conditions are not, you can't treat conditions like that. Conditions often are very complex, integration of different tissue types, different treatment types, different modality types that are going to work for that specific person at that specific time. So that's sort of where I'm heading in regards to treatment of plantar fasciitis, is probably looking at it more as like plantar fascia is like an organ, so to speak, that has multiple tissue types that are involved in the pathology process, and then looking at addressing those particular tissues that are involved in that particular pathology, rather than throwing a one-stop solution at the particular problem.
Yeah. So comparing your practice today in your community and around, kind of globally, what would you say is different or unique to how you're currently treating most of your plantar fasciitis cases versus what a typical podiatrist would do that hasn't stepped up and educated themselves on other options?
Yeah, I think like the typical podiatry model will be go to the podiatrist, get some orthotics, get some exercises, get some shoes. We're a little bit more progressive. Probably you're looking at some electrotherapy. So, people may have shockwave or laser or something like that. So it's so that's probably a really typical type of treatment that you'll get with the podiatrist, and where their focus will be. I'm looking at more so the biological effects of plantar fasciitis on the body, and how can we alter, modulate, and look at improving the biological responses in the body, so the body can actually heal and regenerate those particular tissues that are actually damaged and involved. And it actually requires standing back and taking a different approach or a different perspective in terms of how the disease process actually goes on with plantar fasciitis.
Okay. So when you say you're treating plantar fasciitis like an organ, which is fantastic because it is unique to itself,
Yeah.
When you're implementing your laser and your orthobiologics, what's maybe the misconception that people think about, well, what is this going to do for me versus what my podiatrist has done before with a hard orthotics?
Yeah. What we're finding, and we're still very early days in terms of the treatment protocols and what's out there and what's going to work really effectively. First step is having a look at the plantar fascia as an organ. So what tissues are actually involved in this specific process? So if we have a look, we've got a bone. So we've got the heel bone that's involved. if we have a look, we got soft tissue. So that soft tissue is fatty pad. We're having a look at insertional aspect of the plantar fascia into the heel, so what we call the enthesis. So that's a different tissue type to say what we're looking at in regard to the actual muscles that attach in around that specific area. We're having a look at ligaments that attach in around the heel as well. So the long plantar and the short plantar ligaments that are attaching around the heel, so they can potentially be involved. And then we're having a look at the neurovascular structures that are in around that area that often can get involved. So if we have a look at the heel, the plantar heel, there can be anywhere up to 4 to 5 different nerve branches that are involved in plantar heel pain or plantar fasciitis. So it's that's where the complexity starts to present, because you can get people that may have one nerve involvement, some people that may have a couple of nerves that are involved, some people that may be getting a whole myriad or whole complex of all neural structures that are involved in their plantar fasciitis, as well as the tissue, as well as the ligaments. Treating all of those tissues require different strategies. So you can't just say take a cortisone or a steroid shot and stick that into the heel, hoping that it's going to address the fatty pad, the plantar ligaments, the enthesis. Sometimes people can get a bursa in there as well. So an adventitial bursa will develop in around that particular area, and treating the nerves. So that's where we have to look at, okay, which orthobiologic is going to work well for that specific tissue. And not all orthobiologics that you use to treat, say, an enthesis or an attachment of a ligament into a bone is going to work for nerve tissue. So this is where the nuances actually come in regard of treating the plantar fascia as the organ. Is okay, what tissues are involved first, what tissues are generating the pain, and then what biologics or electrotherapies or other therapies are going to work to help to settle those specific tissues down. And as I'm diving deeper and deeper into this, what I'm finding is that I'm getting better response in terms of particularly chronic plantar fasciitis, is people are responding a lot better and a lot more effectively by taking this more global approach and treating the plantar fascia as an organ.
Okay. So will some patients that come in with plantar fasciitis, will some of them you'll treat laser only, some of them you'll treat orthobiologics only, and some you may treat with a combination of care?
Correct, that's correct. So, particularly early stages. So if someone comes in, they've had the plantar fascia for a week or two, and they haven't got any tears or damage to the enthesis or the plantar fascia itself, then these people will generally respond well to either focused shock waves. So that's really effective. I don't use that personally, but the literature is really strong in around that specific treatment, and also laser therapy. So utilizing the laser to decrease inflammation, increase cellular processes within the tissues to help healing move along as well.
Okay. From the laser aspect, if you use that in your practice, kind of educate people that it's not a laser that you put on it burns. It's not necessarily a red flashlight. What's unique about the laser that you use in your practice?
So we use a brand of laser called the MLS laser, and it uses what's called a dual wavelength. So there's 2 wavelengths of light, and one of those wavelengths is a straight beam, and the other one is a pulse beam. And so what happens with that is 2 effects, is that it stimulates tissue a lot better. And by having a variation in the wavelength, we're getting a better penetration into the tissues as well. So it's called photobiomodulation, low-level light laser therapy is another word for it. And this laser doesn't burn tissue. It can burn tissue, but you'd have to sit there for about an hour with it on in one place, not moving it. So we don't do that, obviously. And it's very painless. And what is great with the laser therapy is you can have the treatment, and then you walk in and you walk out. You can go back to work, and there's no effect on people's lifestyle. Probably the thing with laser for people is that often most people don't feel anything. So when you don't feel anything that's happening, you're thinking nothing's going on or nothing's working. And what we find with the laser, it takes a series of sequential treatments over maybe 1 to 2 weeks, 3 weeks before people start to notice improvement in terms of reduction of pain, reduction of swelling, improvement of function of the tissue or the part that we're looking at treating. Specifically for plantar fasciitis, as someone came in, say they've had it for about 3 to 4 weeks and they don't have any other pathology going on, so no fatty tissue, no nerve pathology, it's just plantar fasciitis is swollen. We'll do a treatment anywhere from twice a week for about 4 to 6 weeks. And most people are responding within about 3 to 4 weeks in terms of that treatment regime. A few people fall out either side of that, but most people are responding really well.
Yeah. I personally had treatment not for plantar fasciitis, but for patellar tendonitis with an MLS laser. It's very robotic. It's a very unique laser, and I had great results with it, thank goodness. So I'm sure your patients are getting the same.
Yeah, it's a great tool. I'd recommend people, all practitioners, having some sort of electrotherapy in their practice, whether it be shockwave or EMTT is another one, and then the laser. I like the laser because it's painless for people. So it's not really invasive for people. My thoughts are the less invasive, the better. But sometimes with different conditions, we have to be a little bit more invasive, particularly with using orthobiologics.
Yeah. So you just said orthobiologics. So Dr. Sibley, there are many different types of orthobiologics that are out there. What are the ones that you focus on in your practice to help patients with plantar fasciitis?
Look, if we have a look at orthobiologics, there's sort of two groups. So one's called autologous, and autologous is basically from the patient's own body. So we pull all the tissue types from the body, whether that be blood products that we'll pull out. So you can also use fat that you can pull out as well. You can also use our bone marrow as well from that person. So there's the autologous, there's the allergenic. So allergenic is using either manufactured or coming from outside of the body. My personal viewpoint is I like to use everything autologous. So I want to use everything that's originated to the person from their own person's body. We were born to, our body's pretty amazing. It was born to heal itself. So it's about utilizing what we've got inside of ourselves to actually get that healing process moving along much more quickly and efficiently.
Okay. And so people will, when it comes to orthobiologics, people will talk about two main ones, stem cells or PRP.
Yes.
It sounds like you use both still, or mainly PRP in your practice?
Look, I predominantly use PRP in our practice, so it's so we get a lot of great. So we have a lot of protocols in terms of we can adjust the PRP to suit specific tissue types. As you start getting into the realm of regenerative medicine and orthobiologics, it's we find that we can do a lot of things to extract really, really great qualities and properties out of our blood products. So there's a lot of growth factors. There's a lot of antimicrobial factors within the PRP itself, and a lot of the platelets. So with the platelets, when they become activated, they start to release a lot of different factors that help tissue to grow, regenerate. Looking at decreasing inflammatory processes in the body. So, out of our own blood products, we can create our own natural cortisone. I don't know if people are aware of that. So it's through different processes of treating the blood and the platelets, and through different centrifuge process and filtering processes, we can actually create your own body's natural cortisone type of product that we can use to inject into joints to actually decrease inflammatory processes that are going on in that joint or in the tissue itself.
Yeah. Do you ever get pushback that people don't want to do, their own blood to treat them? Is there any pushback in it?
Probably the only pushback is that people's hesitancy in terms of they're not educated. So that's the first thing. And then secondly will be the hesitancy of, they don't really want to have any type of injections or anything going on. So with those two factors combined, that often provides doubt for people as to, well, I've never heard of this. My GP doesn't know much. A lot of GPs in Australia don't know much about orthobiologics. So, they're going back saying to their doctors, oh, well, I've had this suggested. And I'd say, well, no, let's stick with the old cortisone. And it just really comes down to education and getting out there and educating people about these products and how effective the products are, and they're safe, like really, really safe to use on people's bodies. So it's, and that's the other thing that I like about it. Yeah, really, really safe, and that people get really, really good responses. In 31 years of being a podiatrist, having treated, let's say, plantar fasciitis for 31 years, which is probably orthobiologics and regenerative medicine is the best, hands down, treatments that I've come across looking at managing these problems and chronic problems. So it's, I'm 100% on board. And I use it myself. I've just recently had, I play cricket and I'm a bowler. So it's like a pitcher in baseball. Right. So I do a lot of pitching. So you get a lot of shoulder stuff going on. So in the last 8 months, I've had 2 PRPs on both of my shoulders, and they've responded really well. It's there's lots of stability back in the shoulders, and I'm pain-free back playing my sports. If it wasn't if I had any doubt, I wouldn't be using it, but I use it on my own self as well.
That's excellent. So from a treatment approach, you have your own, I think, trademark thing called the RegenCode protocol. Can you tell me a little bit about what this is and how the RegenCode protocol helps with plantar fasciitis?
Yeah, what we look at is, so we're a biological organism. And so there are many parts to the biological organism that affect healing and healing processes. And so what we're looking at is, what are those different biological processes that are involved in the healing process, and then looking at addressing those specific areas. So first one's nutrition. So it's a lot of people that I find coming in with musculoskeletal problems, particularly in that age group that I've written the book for, so people over the age of 50. Often what's happened is, we're not eating it, probably don't eat as well, not getting as much nutrition because we're not as active as we were, say, in our 20s. And so we may not be getting the adequate nutrition, and particularly nutrition in terms of like essential amino acids into the body, looking at getting enough protein. Sometimes it's just, I get people to up their protein intake, and that's enough to sort of get the healing process to start moving along for people. I remember a patient I had, he had rheumatoid arthritis. He was about in his 70s, and he was complaining of a lot of knee pain. He was on rheumatoid medication, and I just had a quick little inspection of his diet, and diet was predominantly sugar, carb based, not getting a lot of protein. So the simple thing we did, I asked him 3 times a week to have some sort of protein. So whether it be chicken, turkey, salmon, meat. And then I asked him once a day, at least once a day, have 1 boiled egg a day. So he came back in 6 weeks' time, said all his pains had decreased probably by about 80%. So he hardly had any pain anymore. And he actually started to fill out. So this man was very skinny, looked very withered. And what actually started to happen is he started to fill out and put on a little bit of muscle bulk just in that short period of time of increasing protein. So something as simple as that, like making sure we're getting adequate nutrition to support the healing is really important. So we have a look at, so for some of our folk who we have like a really top end package in our business, and what we do is we do genomic DNA testing, which maps out people's metabolic genome and then has a look at deficiencies in that genome. And then what we do is, where those deficiency lies, we look at implementing supplements to support those metabolic processes in the body. So that's a second aspect of having a look at the biological profile. We also have a look at hormones as well, particularly in that age group, over 50s, men and women. Hormones have a massive impact in terms of musculoskeletal problems and issues. There was an interesting article written by Dr. Vonda Wright. She's an orthopedic surgeon in the States, and the article's titled "The MSK Syndrome of Menopause." Really, really great article. If you can get hold of it, have a read of it. And what she's talking about is how she sees a lot of musculoskeletal problems in women in perimenopause and menopause. And then she looks at managing that with what's called BHRT, so bioidentical hormone replacement therapy. So, and that can really assist in terms of reducing pain and allowing the body to heal itself really well. And it's the same for men. Once men's testosterone levels start to drop, then we start to lose muscle bulk, we start to fatigue, and then the body doesn't repair as well. So if men can keep a good level of testosterone, well, that helps and supports the musculoskeletal system, which is really important in the regenerative process. So there's those aspects. Then we look at exercise, obviously the type of exercise people are doing for their specific activities and what they're doing. And then we have a look at the treatment or management plan in terms of how we're going to actually treat the tissues. Often treatment of tissues, again, if we go back to classical medicine, so you've got plantar heel pain, they'll jab the cortisone and say, okay, let's see how that goes. Where often in orthobiologics, it's like a stage progression of treatments. So we get an initial healing response. And then once we get that initial healing response, then I'll review, say, 6 to 8 weeks down the track to see how the tissues responded. And then we may need to look at modifying the protocol, injection protocol, and then do a repeat injection for people in regards to treating the tissues that may not be responding. So we might find the plantar fascia is responding, settling down, but you still got some neural symptoms. So we may need to implement what's called neural prolotherapy or perineural injection therapy to help get that nerve tissue to settle down and start to respond with those particular conditions. So it's really a complex treatment system that we provide for people to give them really, really great results. But I'm just finding that, like, we're probably 9 out of 10 people we hit home runs with. There's probably about 10% of people that sort of get an average response or don't really respond. But yeah, about 90% of people get a really, really great response over a period of time. So that's probably again, moving away from the classical medical model, quick fix, bang, patch and fix type treatment. The regenerative process is a long-term approach. Healing does take time. You're not going to get immediate pain relief. So pain relief tends to happen maybe 4 to 6 weeks down the track after we start initiating treatments. And then the treatment protocol is moving as we're progressing. So it's a very highly customized, highly tailored approach that we use with the RegenCode for people, but it gets people results.
Yeah. So what I'm hearing from you is you're a podiatrist, but you are also practicing functional and integrated medicine, because it's not just the heel, the plantar fasciitis, it's the whole entire body that helps the heel, that helps the heel pain and plantar fasciitis heal itself, correct?
That is right on. That's spot on. Yeah.
Okay. That's good. Yeah. So who's ever in the Australia area where you're at, they need to see you versus the other, generic medicine that's taken, because the cortisone shot, they'll give them 1, 2, 3 shots. When that starts to break down the tissues, it's causing more damage than good. But the thing that people want is they want instant relief. And the difference is, do you want instant relief that causes you to break down further in time, or do you want long lasting relief that may take a little bit longer in your case, but overall better health, right?
Yeah, correct. It's I say to people, look, you're a really nice person and that, but I don't want you coming back with this problem again. I said, that's not good for you. That's not good for me. That's not good for my reputation as well. So it's while I like you, I don't want to see you back here with this problem again.
That's good. That's good
Yeah.
care. That's integrity and ethics. I appreciate that.
Yeah.
So from kind of the science and innovation, you've written a book, but you've also written a plantar fasciitis guide. Can you tell us a little bit about your book or your guide?
Yeah, the book and the guide basically outlines the treatment protocol that we use in our clinic for addressing particular problems, and it gives people. I wrote the book, so it just gives people, if they get the book, they can go away and implement some things that say if they went to a normal podiatrist, that they can implement at home. So it's like a lot of the treatments that the podiatrist will give you or implement with you, or the strategies, is that most people can find that information themselves, or if it's put together in a specific way, then they can look at implementing that themselves so that they can get a result. What I find is that probably 50% of people, if they get sort of some of these right strategies, like if they get the right footwear, if they get some good massage, like get the muscles working a little bit better, use some tools to decrease inflammation. So it might be like some natural creams. You can get natural anti-inflammatory creams, look at ice packs, heat packs, and then looking at utilizing targeted stretches, and then specific like foot strapping techniques people can use. 50% of people are going to fix the plantar fasciitis themselves. So they don't actually need to go to the podiatrist. The challenge is when the plantar fasciitis gets a little bit beyond, say, 3 to 4 months and starts to become chronic. That's when the tissues are not responding, and where they'll need intervention from a specialist in that particular area. So it's I put that book together, so one, to educate our patients, and all of our patients who come and see us, we send them out a little pack with the book. So they get a book before they come in, so they can go through and read the book. So they start that education process. I'm really big on educating people before they get into my door about what we do, because it's very unique, very specific, and people need to be educated before they come in. And also as a tool that people can take the book, implement some of the things themselves, and start to treat themselves. Like ideally, if we can do that, that's better. But sometimes we do need to go and see the specialists in those fields.
Yeah. So would you say in your local community, or maybe talking with your colleagues across the board, are there more people? I think because, well, we're making a shift of trying to think and be healthier, but we're struggling at that point right now. Would you say there are more people struggling with plantar fasciitis now than ever?
Yes. Yeah. It's sort of like a silent epidemic that's going on. Yeah, in our community, I would say it's a lot of people get it. Fortunately, 50% of people, it will settle down within a short period of time of implementing some good strategies. But particularly in the group, like my group, I call over the age of 50. In that group, it's really big, and I'm seeing probably in my clinic more women than men, and I do believe that's in relation to what's happening in around menopause, perimenopause, and that as well. So that's contributing quite a bit. It's yeah, so it's really not being effectively managed. It's still being used with 1990,000 technology, whereas we're in the 2020s now. So it's like time to get on board with different technologies and treatments.
Yeah, I would agree. And as I look over your shoulder, is that an ultrasound unit that you have in the practice?
Yeah. So that's a ultrasound unit that we. So everyone on their first visit, we do ultrasound assessment of their presenting pathology, and then all of our procedures are what we call ultrasound guided. So it's in this day and age, you need to have that ultrasound guidance so that you're getting accurate delivery of the orthobiologic into the place. I think if you're going to practices where they're injecting blind these days, I think there's risk. There's risk of not delivering the biologic to the right place or to the tissue type, and also risk of damaging other tissues that are involved. So often when I'm injecting in and around nerves, nerves travel in what we call a neurovascular bundle. So there's often a artery and a vein traveling along there. And so you don't want to go injecting into an artery and damaging arteries and causing massive hematomas in around tissues and things like that. So, and you can only identify those with the ultrasound guidance. So the ultrasound has a functionality where we can turn on and it highlights the blood vessels, which makes life very, very easy. Even with our blood draws, while we have a phlebotomist and I'm trained in terms of doing blood draw, I still use the ultrasound to locate the vein and put the put the cannula into the vein so we can get, a correct and ideal placement.
Yeah. Yeah. By using the ultrasound as a diagnostic tool to help, but when you said that you're using it from a guided in your treatment approach, anybody that has hesitancy or reservations about it, there's no need for that anymore, because you're doing exactly what you say. You're specifically guiding the needle where it needs to be, the correct placement, not going for vein, nerve, artery, any of those places. Or if there's a bursa involved, you don't want to be hitting the bursa sac and causing a secondary problem there either.
Yeah, correct. Yeah, correct. And the other thing I like, it's really good education tool. So I'll be talking to the patient as we're going along, because you can actually see the needle going into the tissue. So I'll say, well, this is the tissue that we're targeting. So shortly you'll see the fluid coming out around the nerve or fluid coming out into the tendon. Then I'll show them us putting the orthobiologic into, if they've got a tear. So we'll put it into the tear and they can see the tear starting to fill up. So it's really great. It gets the patient involved in terms of their treatment as well. So it's, I really love it. I think it's a great tool. I think anyone who's doing MSK work must have one of these in their practice.
Well, you're a leader in your community for sure in how you treat with your protocol and how you're using diagnostics to help with that. From a business perspective, Dr. Sibley, what would you say your focus is on right now? Growth, scaling, what are you looking at?
Our big thing at the moment is just increasing the number, so our growth at the moment. So just growing the number of our orthobiologic patients as well. So we're looking at increasing that and just getting what I call our marketing and our nurture systems. I think that's really important in business, is actually nurturing our patients really well once they come into your practice, and nurturing them through the different processes within that particular practice. So we've just mapped our customer journey process, and we've just implemented our nurture sequence until they arrive at the clinic. So there's a whole series of things that we're putting together in regards to that. So it's sort of like you sort of build it and you're adding bits and pieces to it as you go along to support that the nurturing of the patients and education of the patients.
Yeah, it's a very odd comparison, but when I talk to people about nurture sequence, how many times do you drive past a McDonald's and don't go in? Hopefully more than not. But every once in a while, when you just have to have that cheeseburger, you know where it's at and you go. That's your nurture sequence that not everybody is willing to say, okay, on day one, I want to go see Dr. Sibley. It takes some time. So you're educating them along the way, which you said is a strong point. And that's a great way in which you get better results. An educated patient will always give you better results than one that's not.
Yeah, and that's been proven time and time again. When we have a little thing where we send out a pack, and I knew that this pack was a really key step in our process. So people will get the pack and they'll read what's in the pack, and they'll watch our video. And when they do that, they're educated, they come in and they understand the treatments. Whereas people who haven't done that, and they come in and they sit there and it's like they're deer in the headlights. They don't know what's going on. They don't know what's been said. And a couple of times with our processes, because we rely on a third party to get delivery of the package, sometimes that package hasn't arrived. And so the patient arrives uneducated. And so it's frustrating for everyone. So it's frustrating for the patient because they're coming in, they've got all this information they weren't expecting. They're visiting a podiatrist who does stuff that normal podiatrists don't do. And they're really unsure. They haven't heard of this. And so they leave and go, no, I'm not going to do the treatment. So they miss out on an opportunity to get a really, really good treatment protocol because they're not educated. So they've wasted their time and they've wasted their money coming in here to get that done, which is, from my perspective, is really frustrating. I don't like my time being wasted, and I don't like my money being wasted either. So I understand their frustration. So we put into that process so people are educated before they come in. And that little pack helps people decide whether they want to come and see us, or no, they don't want to come and see us, which is really great. It's a really great tool, because if they read it and they go, okay, this isn't for me, I don't want this, then they haven't wasted their time and they haven't wasted their money. So they'll phone up and they'll say, oh, look, I want to cancel my appointment. This isn't for me. We say, great. We give them a refund, and then everyone's happy.
That's good. Everyone's happy, just like the wife. When the wife's happy, everyone's happy. So that's a good thing. What are there some challenges that you're currently seeing in practice right now?
I think for like is the scalability for small practices. I think the way business operates, I've been in business 30 years, and what I have to do now to maintain on top of the game to what I had to do 30 years ago, it's really, really challenging. And for small practices where you're a single practitioner, or maybe one or two or three practitioners, really, really challenging to keep on top of the game and keep on top of everything. I think that's a big challenge. But the other, on the flip side, is when you get involved in big corporates, sometimes what happens is you get lost within that system and the structure, and you can't deliver a good quality, high grade services if, say, you're in a smaller business. I like sort of being in the smaller business because we're quick to, you're quick to respond to any issues or any problems. Whereas if you're in a corporate, it's got to go through management, then it's got to go to a meeting, and that process might take, 2 or 3 months. Whereas if you're in a smaller, you can go bang, we make the decision today. It happens today. So, that's one of the good things about being in the small business. So I think challenges is that there's lots of pressure. There's more pressure to do social media, and that can be time consuming for the small practices and things like that. So I think I think if you're running a small business and you're having to do all of those things and you're keeping on top of your game, you're doing an awesome job. You should pat yourself on the back.
Yeah, good point. Not enough people give themselves enough credit. I want to jump back into kind of patient impact for a second. Can you share a story, a success story of a patient that's gone through your protocol?
Yeah, I have. I've got heaps and heaps of success stories. So it's, but I think one which really typifies about value, offering value, and maybe the viewers or the listeners might be able to take this away. So I had a patient. She had bilateral knee osteoarthritis and bilateral knee pain. And she'd had orthobiologics before provided by another practitioner. And so because we package our services are quite more expensive than the average practitioner because of what we do. So we sat down and I showed her the packages, and even on our lower end package, she said, oh, I can't afford that. I just can't afford that. So I said, okay, that's okay. I said, look, when you're ready, I'm here. I'm here for you. I said, this is what you need to do. This is how we're going to do it. Anyway, so something happened for her, and I really don't understand what happened. And I still can't understand. So between walking out of my office and going out to the front desk, she made a decision to go ahead with treatment. She upgraded from the lower package to our next package level, which is probably about twice as much as our entry level package. And she paid the full amount upfront and invested in the cares. I still can't understand what happened. I don't understand what happened for her. But as she said to me, she said, look, I'm in my 70s. I really like to be active, keep really active. Being able to walk around, do what I do, go traveling, do my overseas hiking and holidays and stuff like that's really important. She said, I'll find the money to be able to do that. Anyway, so we got her involved, and we got her nutrition, we got her hormones kicked in. We did her orthobiologics treatment. So within about a week of having treated, she was pain-free, and she's coming back and she's just sitting in the chair laughing at me. And I said, oh, what's going on? She said, what you do is so unique. She said, I've had PRP before. She said, I hadn't had this response. I haven't had people look at my nutrition, my hormones. I haven't had people take you're really detailed in terms of what you do and very comprehensive. So it's, and she said, I'm so glad that I've done that. So it's, there was lots of surprises of that all around, but what it said to me is that what we're doing is right for people. If people are looking for that, and I think people are getting more educated quickly. People wanting longevity. People want to be more active. They don't want to age like their parents or their grandparents did. You know, they want to be 70 in their 60s, 70s and be still active, feeling like they're 40 again.
Yeah, yeah, very true. That's a great story. If you could figure that out and you could sell that in a bottle as whatever was the transition from your office to the front desk, you'd be able to retire.
Yeah, I don't know.
It was downloaded from above for her to make that decision. That's a great
Yeah,
story.
maybe. I'm not too sure, but
Yeah,
but it worked really, really well. So, and I know that people who commit, what I say to people, I'm really big on the commitment. I say, if you've got any doubt, I say, I don't want you doing it because you're not going to get the result. I just know that. So I'm not there sort of chasing people. I want people who are committed to their healing, committed to like longevity and having really good, healthy, longer lives, and keeping active. If that's what people want, then we can provide that for them. If there's any doubt or anything in regards to that, it's like, if I sense doubt, I'll question the person and we'll speak about that. And if they're doubting, I'll just say, look, this isn't for you at this point in time. I said, when you're ready, come back. I'm not going anywhere. So when you're ready, come on back.
good. So for people that may not be in Australia, do you offer a seminar, maybe for local seminars or webinars where people can learn more about what you have to offer?
Yeah, we do. We've got webinars running. We'll have that up and running within about 4 weeks.
Okay.
There's lots of options that are. One of my dreams is to be able to have a centre set up where people want to have treatment from overseas. We can get them to come to a centre where we can do the treatment. So it's it may be a centre somewhere at an exotic location or something like that where they can come for a holiday, have their treatment, get looked after, relax, recover.
Yeah.
So that's sort of in the pipeline, but people can contact me and happy to share information, send them guides and things like that to help them with their particular problem and give them some direction as well. So I think people that I'm on a lot of plantar fasciitis groups, and I find that people throw out specific ideas and treatments that have worked for them. But there's still people out there frustrated. And so sometimes people just need a planned, stepped approach so that they can get a result. And there's steps that you need to take so that you can get a good, correct diagnosis is the first thing. And then once you've got the diagnosis, then you can manage things really, really well. I think what people get let down with is that they don't get a proper diagnosis. And so 12 months later, still got plantar fasciitis and they're running around frustrated.
Yeah. Well, we're about to wrap up here. I've got a couple more questions I wanted, and I'll ask you, but I'm going to share all of your contact information. But if someone's listening, what's the best way for them to learn more about you and your practice?
Look, if you go to our website and, if you wanted to do a discovery call, we've got a discovery call option there for people. You can also, on the website as well, contact us and we can send you out some information, particularly if you're overseas. Like if you're overseas, we're happy. I have a lot of, because I come to the States 4 times a year for training.
Okay.
So, it's like the US is like my second home. I wish Donald would issue me a green card.
I wish I
Yeah.
could call him and say, hey, you issue Dr. Sibley a green card. I don't have that connection.
Yeah. Can you arrange that, Derek, or what? But it's so I have a lot of contacts in the States where I can, if people specifically are looking for practitioners, and it's also practitioners in Europe as well. So so I sort of get around a bit globally. So I've got contacts, people looking for good people to help them with their specific problems.
Good. All right. So 30 plus years in practice, you know a lot about health and healthcare from your own battles and recovery, and other patients are out there. But if there's one piece of advice you could give our listeners or the people that are viewing this, what's one piece of advice that you would give that's a positive change that they could make to give long lasting effects?
Oh, Derek, that's the challenge, isn't it? There's lots of implement things. I think if you're suffering with, let's say, if you're suffering with something, suffering with a condition, is you want to get really focused. Excuse me. So you want to get really focused on getting a correct diagnosis. You've got to get that correct diagnosis, and do not be afraid to ask your practitioner for a myriad of tests to get those. Sometimes what I have said to patients is you may need to pay for those tests so that you can get those tests to give yourself peace of mind. But the diagnosis is the key. And once you have the diagnosis, then you can implement a really, really good treatment plan for your particular problem. If you're dealing with musculoskeletal problems, I would say something really simple and easy that you can look at doing is, unless you have any allergies to the specific supplement, vitamin C is a really key supplement for collagen, and something really, really simple that can help in terms of collagen restoration, healing, and things like that. So having a look at a supplement, just make sure you don't have any allergies or reactions to the vitamin C itself. But that would be one thing that I would take away. From a foot perspective is good footwear. Like really invest in good footwear for addressing foot problems, particularly like if you're early stages plantar fasciitis, a good pair of shoes can often be the difference of helping your plantar fasciitis and helping it go away, particularly in the early stages.
Okay. Well, it was a 3 for 1. That was good, more than I expected. So thank you for hitting out all of them. I appreciate that. I might have to reach out to Donald and see what I can do for you with that goal.
Yeah, that'll be good.
Yeah. The last question I have for you, Doc, is you're on the Prime Health podcast. I ask everybody, what is your definition of Prime Health?
Prime Health for me is cutting edge, leading edge health systems that are available for people in terms of helping people with diseases or conditions improve those, and then look at, say, curing them. And then Prime Health would be also having a look at, I sort of see that incorporates the longevity space. So looking at creating an optimum biological environment within your body, and then implementing those strategies and protocols so you have prime health. So particularly as we're aging or getting into our older years, is that we can live really fruitful, active, and prosperous years.
Yeah. Well, I know the gray hair of me doesn't say that I'm in my 50s, but I am. So I can appreciate as we age ourselves that it's important to meet that prime health category. So thank you for sharing that. And Dr. Sibley, I appreciate the insights you give me. It's great to be able to, this is much more than I thought. And I don't mean to discredit you by any means by stating that. I thought it was going to be a conversation with a podiatrist, but the amount of work that you put in for your patients is incredible. It's not just about the focal point that's on the bottom of the heel. It's really how you're looking at the entire body that gives them longer lasting relief as well as short-term results eventually because of the pain that they present in. So thanks for sharing your insights with us. I can appreciate that. But I also want people, go ahead, Doc.
No, I was going to say, it's awesome. It's awesome to be able to share this with people. So thanks, Derek.
Yeah. Oh, absolutely. But what's most important, I want people to take away. You and I, of course, want this selfishly to be shared. We want more people to hear our message. But the truth is, if you know somebody that's suffering with things that Dr. Sibley can help them with, share this. Give that to that one person or those 3 people that could truly benefit, whether they're in Australia or not. They can take advantage of what he can offer. And he's connected, as he said. And if he can't help you, I'm sure he would point you in the right direction. So again, his contact information will be below, so you can reach out to him. And of course, I'd love for you to subscribe to our podcast and share it with anybody else that's out there. So until next time, remember that true wellness is a journey we are all on together. Now, whether you're taking charge of your own health or guiding others on theirs, every step forward matters. I want you to stay committed to your prime health journey. And again, Dr. Sibley, thank you so very much for your time today.
Yeah, thanks, Derek. Really appreciate it.